a patient comes in to see me here at OCR for a concussion, my initial role is really to spend a good amount of time talking with the patient about how they're feeling from a physical perspective, but also how they're experiencing symptoms in terms of their mood and thinking skills. And then to also spend a good time to understand kind of what their day-to-day life looks like, what's important to them in terms of school or work, hobbies, recreational activities, things like that. It's essentially what we're aiming to get them back to when they're ready and safe to get back to those things following a concussion. I see my role as kind of taking all of that information together, so how someone is feeling after concussion, and then the things that are important to them in day-to-day life, and how do we start to integrate back into those activities. We know that after a concussion it's really important to be able to get back into kind of normal routine and into activity safely with regard to how somebody recovers after a concussion. Often what that looks like is really sitting with patients who include student athletes or adults who've experienced things like maybe a slip and fall or a car accident, a variety of different kind of injury mechanisms, and being able to really sit with them and say, well, here's the symptoms that you're experiencing, here's what we're needing to get back to, and let's kind of talk through a step-by-step process of how to get back into what your normal life looks like. And to make sure that we're doing that safely, particularly if we're talking about returning to things like contact sports or other recreational activities that have some degree of risk involved for